I'm Dr. Bill Burman. I'm the head of public health at Denver Health. The numbers continue to get better. So we look at things like the case rate per day, the percent of tests that are positive. We look at other jurisdictions that are close to us, and in all those metrics, things continue to improve. Case rates are falling, percent positivity is decreasing, hospitalizations are falling. So I think the overall COVID situation continues to improve. Everybody's concerned, appropriately so, about this B117 variant, the so-called UK strain, and that's a concern. There have been some concerns this week about whether there might be an increased mortality rate with that strain. I think that's still very much uncertain. I think the key thing is that it's associated with increased transmission and therefore a concern. It's being looked for prospectively in Colorado, particularly at the state lab. It is present in Colorado. About 10 people have been found to have this. So it's there, it's at low prevalence, but it's certainly a reason for concern. It doesn't impact what I think schools should do. I think schools should respond to the current epidemiologic situation while watching closely what this variant and other variants might do. I think the key thing that changed was our knowledge about transmission of COVID in schools. So I think what really led us to suggest this change was the data from school districts in the Denver area and more broadly across the country that schools can be safe places when the standard prevention measures are followed very well, even when community transmission is higher than it had been at times last summer. So it isn't the epidemiologic situation that's changed so much, it's the clarity that school can be a safe place at community transmission rates that we're currently at. The best studies we have available to us suggest that masking decreases the transmission of COVID by 80 or 85%, that distancing at least 3 feet decreases the risk of transmission by 75 or 80%, that the addition of eyewear when close contact can't be avoided decreases transmission, that symptom screening and rapid evaluation of those with symptoms probably decreases transmission by another 50%. And so it's this concept that we've talked about of layers of protection, that no one layer provides an adequate level of protection. But when you add up the combined effect of masking, distancing, evaluation of persons with symptoms, excluding them from school until they've been evaluated, improvements in ventilation, that when you add up all of those, they provide a very effective set of prevention measures. So we're helping Denver Public Schools right now vaccinate staff members who meet the current criteria. And to quickly remind you, that includes healthcare staff. So in the case of the school, that's school nurses, physical therapists, occupational therapists, et cetera, as well as DPS staff who are 70 years of age and older. So those individuals all meet the current criteria from the governor for vaccination, and we and others are assisting in getting those people vaccinated. I guess the key thing developed yesterday, the state announced that when we get to the so-called essential workers class, that school staff will be the first among the essential workers. The state has estimated that may be about a month away. That's still an estimate, but that's the best estimate we have.